Most people don't need another list of things they should be doing for their health. They're already carrying that list around in their heads and quietly feeling like they're failing at it. Move more, eat better, manage stress, sleep more. If information alone could make us healthy, we'd all be thriving. What I see over and over is something deeper than a knowledge gap. A lot of people are genuinely trying, changing what they eat, buying supplements, downloading apps, starting and stopping programs. They're putting in effort and still waking up tired, sore, or discouraged that their body doesn't feel like it should for the work they're actually doing. That is incredibly discouraging, and this isn't about blame. You are not broken. You are not lazy. You are not a lost cause. You are not weak, and you're not doomed because you haven't figured it out yet. But no one is coming to do this for you. At some point, your health has to stop being a background worry and start becoming a priority you choose on purpose. That doesn't mean chasing perfection or living like a full-time athlete. It means understanding what actually matters for you right now in this season of your life and taking ownership of a few concrete changes that move you in the right direction. Where I come in is helping you sort signal from noise, understanding what actually matters for your body, your season of life, and your priorities, and what you can let go of. Not with a one-size-fits-all formula, but with honest conversation and clear information so you can make decisions about your own health. In this video, I want to talk honestly about why health feels so hard, why that doesn't mean it's impossible, and how I support people who are ready to take that responsibility without burning themselves out. That pattern of trying hard without seeing payoff isn't anecdotal. It shows up clearly in the data. In Canada today, about 2/3 of adults are classified as overweight or obese. That figure has been stable at an uncomfortably high level for years, despite more fitness products, nutrition advice, and health spending than any previous generation. Chronic disease follows the same trajectory. Roughly 1 in 4 Canadian adults has diagnosed hypertension, and just over 11% are living with diabetes, predominantly type 2. Both conditions are being diagnosed earlier in life than they were a generation ago, which means people are spending more years managing disease rather than preventing it. What's changed most noticeably is age. Type 2 diabetes, once considered an adult-onset condition, is now routinely diagnosed in adolescents alongside rising rates of clinically significant anxiety disorders in children and teens. These are no longer rare or edge cases in pediatric care. They're part of the baseline clinicians now expect to see. At the other end of the lifespan, Canadians are living longer than ever. Life expectancy now averages about 82 years. But longevity and capacity are not the same thing. Surveys consistently show that around half of older adults report difficulty with basic physical tasks like climbing stairs, carrying groceries, or engaging in active play with grandchildren because of pain, weakness, or limited mobility. None of this points to individual failure, and it's not explained by genetics alone. These trends reflect what happens when small, reasonable decisions accumulate over decades in an environment that makes health harder to maintain than we like to admit. The important part is this: these numbers describe patterns, not destiny. Trends can shift, outcomes can change, but only if we stop pretending that awareness alone is the same as action, or that effort automatically guarantees results. That gap between effort and outcome is where most people get stuck, and it's where the next part of this conversation begins. Most people aren't confused about health. They know movement matters. They know sleep helps. They know what a reasonable meal looks like. And yet knowing rarely turns into consistency. That gap isn't laziness. It's not ignorance. It's not a lack of discipline. It's human behavior colliding with modern conditions. We're asking brains designed for scarcity, novelty, and short-term reward to thrive in an environment built on convenience, stimulation, and constant interruption. That mismatch matters. Research in behavioral science shows that knowledge alone is a weak driver of behavior change. Information changes opinions easily. It changes habits poorly. Habits respond to context, friction, fatigue, and identity, not just good intentions. Add time pressure, financial stress, caregiving, shift work, chronic pain, poor sleep, or a body that no longer responds the way it used to, and even simple health behaviors become complicated very quickly. There's also how we frame the task. Health is often treated like a renovation. Tear everything down, start fresh, new plan, new rules, new identity. That approach works briefly, mostly for people with excess time and energy. For everyone else, it burns out fast. Most adults aren't failing because they won't try. They're failing because the model assumes unlimited capacity and perfect conditions. Neither exists. The reality is quieter and less dramatic. Health behaves more like a practice than a project. Something adjusted, revisited, negotiated with real life. Something that has to tolerate bad weeks, changing priorities, and imperfect execution. When the approach doesn't account for how people actually live, the problem isn't motivation, it's design. And that's where the conversation needs to shift next. In nutrition coaching, there's a common assumption that you have to be perfect to get results. Precision Nutrition looked at actual client data from a year-long coaching program that included about 1,000 people and nearly 1 million habit and workout data points. What they found challenges that assumption in a clear way. People don't need to hit 100% consistency to see meaningful changes in their bodies and health metrics. When clients reported doing their assigned habits and workouts less than 50% of the time, they still lost measurable weight and reduced body measurements over the course of the year. They weren't perfect. They didn't hit every habit every day, and yet they still changed in ways that mattered for health and risk factors. More interestingly, people who were between about 50% and 79% consistent with their habits, so doing them in roughly half to 4/5 of the opportunities, had similar outcomes across that range. There was no statistical difference between someone at 52% and someone at 78% consistency for the main outcomes measure. That means that there's a broad, practical zone where imperfect effort still delivers real results. This fits the idea that nutrition and health behaviors exist on a spectrum, not a binary of success versus failure. What matters in practice is making the best decision in the moment you're in, not rigidly following a plan word for word or swinging between all or nothing extremes. Following the best choice you can make right then, repeatedly over time, accumulates into meaningful change. That's consistent with both how people actually live and what the data shows about habit practice and outcomes. This is where most health messaging gets abstract. I prefer concrete. I don't sell a single method or a fixed sequence. I work across several domains because real bodies don't separate themselves neatly into categories. But that does not mean everyone needs everything. People come in for different reasons. Some come for strength and mobility because their body hurts, feels unreliable, or no longer does what it used to. The work there is pragmatic. Build capacity, restore range, reduce friction in daily movement, no theatrics. Some come for respiratory work because breathing is affecting sleep, recovery, anxiety, pain, or endurance. Breathing is foundational, but is often ignored until it becomes a problem. When addressed properly, it changes how the nervous system, posture, and performance behave. Some come for nutrition coaching because they are tired of rules that don't survive real life. The focus is not perfection, it's decision-making, understanding trade-offs, choosing the best option available in that moment, knowing that consistency lives on a spectrum. Some come for sleep because everything else is harder when sleep is poor. We work on behavior, environment, physiology, and expectations. Not hacks, not gadgets, fundamentals applied to the life that they actually have. And some come for botanical support as a complement, not a replacement, to the rest. Used judiciously, plants can support digestion, inflammation, respiratory health, and recovery. Used indiscriminately, they do very little. context matters. All of this can be done online and often is. Geography is rarely the limiting factor. Design is. People may work on one area or several. That choice is theirs. The work adapts as life changes. No moralizing, no you should. Just skill building applied where it's most useful. Health doesn't need to be dramatic to be effective. It needs to be workable. This work isn't about fixing you. It isn't a reset, a challenge, or a transformation arc. There's no promise that everything will suddenly feel easy or that life will cooperate once you get it right. It also isn't passive. I'm not here to hand out information and hope something sticks. The internet is already full of that. What this is applied support. We take what matters most in your current context and make it more workable. That might mean fewer rules, not more. It might mean doing less, but doing it more consistently. It almost always means letting go of the idea that health needs to look impressive to count. This work respects limits: time, energy, money, stress, injuries, age, history. Those aren't obstacles to work around later. They're the starting point. It's also not an all or nothing commitment. You don't need to buy into a philosophy or overhaul your life. Some people come in for a specific problem, solve it, and move on. Others stay because the process itself becomes useful. If you're looking for certainty, guarantees, or a script to follow blindly, this won't be a good fit. If you're looking to develop skills that hold up under pressure, distraction, and real life, then we're likely speaking the same language. That's the distinction that matters. Most people already sense when the usual approaches aren't working for them anymore. They may not have the language for it, they may not know what to replace them with, and they may hesitate because trying something different carries risk. Disappointment, wasted effort, or confirming the fear that this just isn't possible. That hesitation is understandable. This is an invitation to work differently, not harder. To step out of rigid plans and into something more responsive. To treat health as a set of skills that can be developed, not a test you pass or fail. You don't need certainty to start. You don't need confidence. You don't even need clarity about the long term. You only need a willingness to engage honestly with where you are right now and to try a different way forward with support that respects your intelligence and your autonomy. If that resonates, the next step is simple. We talk. We look at what matters most in your situation and we decide whether working together makes sense. No pressure, no performance, just a conversation and a choice.